Every child, during the ages of 12 to 18, undergoes both physical and behavioral changes. This period, between 12 and 18 years, is known as adolescence. During this period, both boys and girls register rapid physical growth, accompanied by changes like the growth of body hair and a sexual awakening. The voice starts to break to become deeper in the case of boys. In the wake of all these changes, adolescents are very vulnerable mentally and psychologically during this time. Adolescence is the crucial period that acts as a bridge between childhood and adulthood, when curiosity and the need to experiment and discover themselves is powerful among youngsters. It is this natural curiosity and the need to experiment that takes them to drugs, alcohol, and smoking. Though the first time is usually due to curiosity, later the youngster is tempted to take drugs, drink, or smoke on a regular basis due to their perceived stress buster effects. This might serve as a way to escape the stress to perform academically, an unsupportive family, or peer pressure. Often, some youngsters are seen advocating drugs, drinks, and alcohol as cool, thereby increasing the number of youngsters that are lured to these vices. Television, movies, newspapers, and the internet add to these perceptions by flashing cool images of smoking and drinking in popular public figures such as actors, singers, and sportspersons. Led by all these factors, adolescents frequently begin to use drugs, alcohol, and smoke repeatedly. The temporary feeling of euphoria and calmness that drugs and drinks provide drives youngsters to seek these out even when not needed. And even though this consumption proves self-destructive, this psychological attachment to the effects of drugs and alcohol that leave a temporary feeling of well-being is called addiction. The inherent addictive nature of both alcohol and drugs ensures that with repeated use, the tolerance level of receptors present in the body increases. As a result, these receptors respond only to higher doses of drugs and alcohol, leading to increased intake and addiction. Thus, the drug abuser or alcoholic is drawn into a helpless, vicious circle where they consume drugs or alcohol regularly and can't stop. Without any counseling or support, they become dependent on drugs and alcohol. Dependence is defined by the tendency of the body to display unpleasant withdrawal symptoms if their regular dose of drugs or alcohol is discontinued. Deprived of drugs and alcohol, the addicted youngster displays symptoms such as anxiety, shakiness, nausea, palpitations, and sweating. All these symptoms stop when drug-alcohol use is resumed. At times, these withdrawal symptoms can be severe and life-threatening. This dependence on drugs and alcohol leads the addicted patient to ignore social norms or laws to get sufficient funds to sate their needs. Therefore, adequate moral support and counseling at home and in school is required during adolescence to avoid substance abuse among youngsters. Also, the addicted youngsters can be helped and rehabilitated with professional medical care along with counseling.